that sits here, and then these are also muscles supporting this tissue. And normally when the muscle's contracted, it's held forward, but if you're not getting that muscle contraction message getting there, gravity just means the tongue and all this soft tissue falls back and the airway gets blocked. Now he'll tolerate that for a certain number of breaths before the brain will say, hey, that's not right, and cause a disruption of sleep. Now it doesn't cause you to wake up fully. The bed partner would see a snorting, a gasp and a bit of restlessness, and then back to steady snoring again. Or people might just report their restless a lot of the night, waking up feeling refreshed because of constant breathing problems at night. Okay. So this doesn't project that well, but this is someone with obstructive sleep apnea, someone who's got a cardiac they're obese. And the chest goes in and the tummy, chest goes out, tummy goes in, which is characteristic breathing you see when the airway's blocked. Normally both go out together, but when it goes like that, it means the upper airway's blocked. You get that blockage for a while, and it just dries harder and harder, and then it opens up with a big gasp. And if I do a sleep study, this is what it looks like. So this is again 5 minutes of data across the page, and this is airflow through the nose in this case. So really for a minute and a half there's no air getting in through the nose, a little bit in through the mouth. The band around the chest is still going up and down, as is the one around the abdomen. And so that goes on for a minute and a half or so. The oxygen level gradually falls away, and the brain says, hey, you've had enough of that. There's a little awakening, the chin muscle gives a twitch, the legs, actually I've got the legs on this trace, but the legs usually give a kick, and then there's a couple of big gasps, and then drift back to sleep, and the same thing happens again. Just a cycle that goes on and on across the night. Now, how do we treat sleep apnea? This is the most common treatment that we use, a thing called CPAP, and it's an air pressure device. This is the device, one of the examples of a device like this. And you have an airtight system that fits over the nose or the nose and mouth, so that air pressure can support the tissues in the upper airway. There's good and bad to CPAP. It works really well. The bad is it can be hard to tolerate. Now this is an ad from a CPAP manufacturer. Where it all just looks wonderful. It's got this little thing on, and everyone's peaceful and happy and great. And this is a patient's thing from one of their blog websites about their interpretation of CPAP, about how it's a dreadfully intrusive thing that makes them look like a freak. The truth is somewhere in between. So that it's very rarely as straightforward and as lovely an experience as this, and very rarely as dreadful an experience as this. It is the truth somewhere in between. And generally the people who go best with CPAP are people who are sleepy, because if normal human behaviour is if you do something and you feel better as a consequence, then you'll do it again. So people who are sleepy and are able to wear their CPAP machines and feel less sleepy go pretty well with it, and will use it pretty commonly. There are some other treatments we use for sleep apnea, and they're appliances in the mouth that work by bringing the lower jaw forward. So that if the problem is the base of the tongue, if you can bring the lower jaw and the tongue forward, then you can improve sleep apnea, but it generally works in only fairly mild cases. And this is some of the appliances. This is an Australian designed appliance, some of the appliances that can be used. And these are advertised very heavily on the radio at the moment. So another condition that's quite common in the general population, but also common in SCAR, is lots of leg movement during sleep. And usually they're very frequent movements, and it happens every 20 to 40 seconds or so. The legs give a bit of a twitch. It can be more vigorous than that, and it can actually cause sleep disruption in itself. Now there is a condition called restless leg syndrome that lots of people get. That's not really necessarily something that disturbs sleep. That's more something that people describe before they go to bed, or sitting in meetings like this, or sitting on a plane, or going to the movies. Can't sit still, got to jig around a lot and move the legs a lot. It's more, what I say in a sleep study is there's very frequent leg movements disturbing sleep, which can happen in people with restless legs, but don't always happen in restless legs. Now these limb movements are increased in people with neurological problems, either peripheral neuropathy, but also central neurodegenerative problems like SCAR, because of this loss of the cholinergic secreting neurons that are turning off movement, normally turning off movements during sleep. You're not getting that suppression of movements during sleep, so you get this inert rhythm that comes from the spinal cord of movements that just goes on and on and on through the night. Right, so this video is in fast motion, so they're going just as boring to watch otherwise. But this is the typical thing, the same movement over and over again, every 20 to 40 seconds, just constantly through the night. Now these have got it only in one leg, but I see people who get it in both legs, arms as well, the trunk, and if that's going on right through the night, it can just cause sleep to be really fragmented and really disrupted. And when I look at that on a sleep study, this time there's 2 minutes across the page. This is the brainwave activity. So this is leg movements. You get this big twitch in the legs occurring about every 20 seconds. That causes, at the same time, causes a change in the EEG pattern, a change in sleep. And if that happens enough, it causes people to feel tired the next day. Now the last condition I want to talk about is something called REM behaviour disorder, and literally it's acting out dreams, where instead of getting that complete turning off of motor control during sleep, people actually are acting out their dreams. Now, I talked about dogs before. Even if you've got really old dogs, you see them start to bark and woof in their sleep and move around a bit more. That's because that system that turns off motor control in sleep is just starting not to work so well. Now, very newborn babies can get the same thing as well, because the system's just not quite developed perfectly. But it happens in humans too. And in humans, as we get older, it starts to become more common. The commonest thing I see causing this is antidepressants. 30, 40-year-olds on antidepressants get this. But it happens in neurodegenerative disorders because it is that cholinergic neurons in the pons that suppress this movement during REM. So there's a guy in dreaming sleep, and he's chatting away, moving his hands, having quite a conversation. So it's not like normal sleep talking, which is a lot more passive. It's now swatting at things out of bed. So that sort of acting out of dreams. And often what the bed waking, and not like sleepwalking. If you either the other people, kids are the most common thing in sleepwalking. You wake kids up from sleepwalking very disorientated, and often you can just guide them back to bed and they'll go straight back to sleep. With this, people will usually wake up and have some awareness of what they were doing, and it's not just a straight back to sleep. This is what I see on a sleep study in this type of condition. So 30 seconds across the page this time. And this is muscle tone in the chin. And normally muscle tone in the chin, you won't have noticed because you won't have really been on the other times, but it's pretty flat during sleep. Whereas in this, you're getting lots and lots of twitches in the muscle tone in the chin. The muscle tone's not being turned off during sleep in the way